AM.com. Jersey moves fast. Join the show that keeps you one step ahead. Jersey Central with Bert Barron on the new Talk Radio 1450 WCTC.
It is 7:08. It's hour number 2 of Jersey Central on the new Talk Radio 1450 WCTC, the voice of Central Jersey. Good morning to you. It's Bert. Our contest coming up later on in this 7 o'clock hour. Voucher good for a pair of tickets to catch The Outsider at Paper Mill Playhouse in Millburn, so stick around for your chance to win. Well, of course, with the cold weather we've had so far this winter, the likelihood of contracting the flu or a cold, of course, increases. And when it comes to the flu, the first 24 to 48 hours of a cold or flu are critical to diagnosing the symptoms before it's too late. Joining me now on the Jersey Central Newsmaker Hotline to talk about some high and low-tech tips to protect your family and, of course, yourself from the cold and the flu. Let us welcome in a board-certified family practice physician. Dr. Heather Hawthorne is with us here on WCTC. Dr. Hawthorne, good morning. It's Bert. How are you?
Hi, Bert. I'm great. Thanks for having me this morning. Such an important topic.
Yikes. Are we at the epidemic level? I know when you look at the map of the entire U.S., where is New Jersey? Are we sort of in the epidemic level in terms of flu so far?
Absolutely. We're definitely epidemic level. It's everywhere, all at the same time.
Compare it to last year. Is it more severe than what we saw last winter?
You know, a couple of things. It's everywhere all at the same time, earlier than we would have expected and earlier than last year. And then the particular strain that we're seeing the most of causes very severe symptoms. So definitely worse than where we were this time last year.
Why are those first 24 to 48 hours so critical when it comes to staving off the cold or the flu?
You know, the prescription available, the antivirals that we have to treat influenza are most effective if you start them in that first 24 to 48 hours. Beyond that, not very effective. So it's a time-sensitive medication. It's really important to act fast if you're not sure. Is this just a bad cold or a flu? You've got to get that figured out as quickly as possible.
What are some of the early symptoms that people should look for?
Well, it's very difficult in the beginning of a bad cold and the flu to differentiate the two. But the real thing that we see more with flu, high fevers, also those extreme body aches. The flu tends to hit very abruptly. So, you know, I have patients that tell me they remember the actual minute of the day that it hit them because they get hit so hard, so fast, where colds typically more gradual course of illness.
Is there really such a thing, Dr. Hawthorne, as in avoiding catching a cold or the flu? We hear about, washing your hands and cover your mouth and nose and all that. Can it really be avoided?
It can to some extent. It's so important that you go out and get your flu shot if you haven't already. It's definitely not too late. It's not a perfect shot, but it's the best we've got. And it will provide some protection. But, washing your hands is important, not touching your face. I see a lot of people who, they prop their chin on their fist during the day when they're kind of sitting at their desk or constantly touching their nose or their mouth or rubbing their eyes. That's a fast way to get those contaminants off of your hand into your respiratory tract where these viruses, cold and flu, thrive.
And for you, Dr. Hawthorne, our guest is Heather Hawthorne, a board-certified family practice physician. She's with a group called Doctor on Demand. And I like the concept, Dr. Hawthorne, of what Doctor on Demand is all about. Can you talk about how exactly this concept of telemedicine works?
Sure, Bert. Did you know using an app on your smartphone, you can connect with a board-certified physician for a face-to-face video visit, complete with a history, a physical exam. We can give you a diagnosis. We can come up with a treatment plan. We can write prescriptions and order labs if necessary, and you can do this all from the comfort of wherever you are. You can do it from your studio. You can do it from bed if you're too tired and ill to get out of bed. It's available 24/7, 365 days a year, so there's no reason, especially during this flu season, to not get the advice of a physician when you fall ill.
And there's probably a couple people, Dr. Hawthorne, as soon as you see them, whether it's on a smartphone or a tablet or a computer, you get to look at them on the webcam and you're like, whoa, you really are sick. Just by kind of looking at them, right?
Yes,
right.
sir. That's the nice thing about video visits. I mean, you can quickly take a look at someone and know, we've got to act fast. This could potentially be something serious.
Gotcha. When do we get out of the woods? Does flu season end in this particular part of the country, Dr. Hawthorne? We're in New Jersey. We're in the mid-Atlantic states. Does flu season and cold season actually have sort of an end here in Jersey?
Yeah. So the bad news, Bert, is the flu typically peaks in February.
Wow.
And it often lingers all the way through March. That's why I was saying if you haven't gotten a flu shot, it's not too late. We have a lot of weeks of illness left around the country.
So we're still on this roller coaster. We're still climbing that first big hill. Is that what you're saying?
Absolutely.
Oh, boy. All right. Well, where can we get some more information to Dr. Hawthorne on Doctors on Demand? How do we do that?
Yeah, visit our website, drondemand.com. You can learn more about the conditions that we treat. We treat 18 of the top reasons you would end up in an ER and a lot more beyond that. So drondemand.com. We even take insurance, and you can find out if your insurance is accepted from our website.
All right. Terrific. Dr. Heather Hawthorne, board-certified family practice physician with Doctor on Demand, and trying to help us keep as healthy and safe as we can with flu season, which hasn't even peaked yet here in Jersey. I appreciate the information, Dr. Hawthorne. Have a great and very healthy day, all right?
Thank you so much for having me, Bert. Stay
All right.
well.
My pleasure. You as well. Thank you. All right. 732